All right, everybody, good morning. Thank you very much for coming along to the Introduction to Systematic Reviews presentation. My name is Jackie Stevens. I'm the Manager of Research Services in the library. And the reason that we instigated this session was that both Lydia and myself fielded an awful lot of questions from research students and academics about systematic reviews, people wanting to know what it is, people having not a very good idea of whether or not they should do one. And so we decided in the library that it was probably very timely to broach the topic and set up a session so you got some expert information. So today we're going to have a combination presentation of Lydia from the library, who's Liaison Librarian for Health Sciences, so medicine, nursing, health science and physiotherapy. And we have Professor Ben Wand from the School of Physiotherapy to give a practitioner's point of view about actually undertaking a systematic review and what's involved. So between the two of them, we should be able to cover off on most of your questions. We'll have a Q&A session at the very end. So I'm going to hand over to Lydia, who's going to be our first speaker, and we'll get you to save your questions, as I mentioned, till the very end. Thanks very much.
Hi everyone, and hi to everyone who's joining us via Camtasia link from all over the country, which is very exciting. So what we're going to do today, we're going to talk, as Jackie said, two parts. So the first part is talking about, overall what's a systematic review, how does it differ from other reviews, how do you plan for one, what's a protocol. We're going to look at research questions and searching and documentation and all of that side of the systematic review. And the second part, which Ben will be covering, is looking at selecting the studies and deciding what's in and what's out. How do you appraise and evaluate the studies that you're going to keep as part of your review? And also just a bit of his experience with actually conducting a systematic review, as well as supervising students, which I'm sure that many of you will be doing soon. I work with staff on the Fremantle campus in all the health areas, and I just work with them, advising basically everything to do with the search process, access scholarly information, referencing, managing information, so things to do with EndNote and RefWorks, helping provide guidance along the way. With systematic reviews, I don't do the actual systematic review searching because, as you'll see, it's quite an involved process. But I do provide advice and guidance. And then I also manage the collection to do with print and electronic resources in the health fields for Fremantle. So what is a systematic review? And this is a really important definition actually, because it can be confused with other things. So really what a systematic review is something where you've got a very clearly defined research question, and ahead of time, you're specifying the criteria of how you're going to investigate that question. So it's basically a very scientifically based literature review. So ahead of time, you're going to create a protocol which determines what you're looking at, what kind of searching you're going to do, where you're going to search, what kinds of studies you're looking for, how you might select and appraise those studies, and then basically your conclusion and how you're going to analyze those studies as well. So you can see it's the sort of giant sieve analogy here is often used. So you can see that at the top you've got a lot of planning ahead, and then there's a lot of sifting involved before you actually write up your findings. So it's basically applying the sort of scientific process to a literature review. And they're really popular for a lot of reasons. Obviously, they're a very high quality piece of information, source of review, because they take a lot of time, they take a lot of resources, and they're very transparent and rigorous in the process. So people can read them knowing that all the best quality studies have been found, they've been analyzed, and here's the bottom line. They save time for clinicians. Instead of having to read every possible study, they've come to the conclusion based on someone else's analysis. So they are becoming increasingly popular. They've been around for a long time, but they seem to be sort of really becoming more and more popular, and not just in health, but in other areas too, in education and business, a few other areas. I will be focusing on health because that's my area, but systematic reviews are in a few different disciplines. So let's look at the difference between a systematic review and just a plain old literature review. So when you do a literature review, and most of us have done one, there's not sort of a very clear process to a literature review. You know, you might search in a database that you like and find a few things that look good. It can take not a huge amount of time, a few weeks, a few months, if you're being a bit rigorous. Oftentimes people will just sort of gather up bits and pieces as they go. They might not have a very rigorous sort of search strategy planned out. Literature reviews obviously provide a really good summary and overview of a topic, but we don't know what the author has decided to include and exclude in that literature review and why. That's not really often specified, so it's not very transparent. You know, you can have a pretty broad question, do a literature review. You can do a literature review on just about anything. You don't really have to provide a huge amount of documentation, and you certainly don't have to publish a plan ahead of time saying what you're going to do a literature review about, because, you know, nothing would get done. They are great, but they often really vary in quality and really vary in bias in terms of what's being included and not. A systematic review, on the other hand, is really different, and what really differentiates it from your typical literature review would probably be the protocol. So the protocol is a plan that you publish ahead of time that dictates what exactly you're going to do with your systematic review and how you're going to do it, what your question is, how you're going to search for literature relating to that question, how you're going to determine what's in and what's out, how you're going to analyze those studies, how you're going to evaluate them for quality, and basically documenting everything along the way. And that protocol actually does get published. It's often peer-reviewed as well, and that's something that allows people to see the difference between what you said you were going to do and what you've actually done once the systematic review has been published. So it provides transparency, and it also shows that you're doing things in the least biased way that you can. With systematic reviews as well, you want to have a very clearly defined question, nothing wishy-washy. It can't be sort of something that can only be explained, you know, over a couple of cocktails. It has to be something that really is clearly defined and scientific. The other things you'll notice is the number of authors. I could crank out a literature review, that's fine. I cannot crank out a systematic review. You need, they say 2 to 3 at least to do a systematic review. It's definitely a team effort because you need people with lots of different skills to do one. So the team approach is really important. Also the timeline, you can see months to years. So I've read it's not no hard and fast rule. It might depend on the size of your team, but it could take you 18 months to properly do a systematic review. When you think about actually writing up a plan, publishing that plan, all of that time that it would take. So at least a year oftentimes. You also need to have on your team people that have a pretty thorough knowledge of the topic, and also probably people who've had experience doing a systematic review before, so a bit of training as well. And you probably need someone who knows a bit about statistics to help with that meta-analysis. But at the end of that, because you've been so rigorous, so transparent, and so systematic, your reward is that your review gets to sit at the top of that evidence pyramid, the gold standard product, better than the literature review that's, you know, a little bit murkier. So, are you sure you need to do a systematic review? Not every question lends itself so well to this format. Not everything needs to be a systematic review. There's lots of different kinds of literature reviews you can do. So you need to ask yourself a few different questions. Like I said, can you clearly define what your topic is about? When I work with people, it's interesting because there's a difference between you and I having a conversation as two humans and you describing it to me, and whether or not you can actually write it down. If you can't write it down in a very short, concise sentence, it's probably not a very well-defined question, because it's not the importance of whether or not I can understand it as another human, it's whether or not it can be translatable into a database search. So if it's something that's a little bit fuzzy around the edges, it can't be translated very well into a database search. So can you clearly define and articulate that question? Do you know what you're trying to do? Does it have a clear objective? What are you actually trying to find here? And is there enough literature out there to even do it? Have you Have you done a little bit of a scoping search beforehand? Are there like 2 studies? One of them's in German and was done in 1984. Are there, is there enough to do? Is there enough to sift through? That's another thing to look at. Also, do you have the time? Do you have that 12 to 18 months? Or is it due next Thursday? If it is, probably not a systematic review for you. Do you have the resources? Again, are you ready to put a team together to make it as good as it can be? So people on your team, like I said, you might have someone who's done the training before, done a systematic review to help oversee that process, someone who knows the content, maybe knows the literature pretty well already, someone who can handle the numbers and the analysis and the statistical side of things, and also someone who's an expert searcher. So this could be a librarian or someone who knows how to search a database in that particularly rigorous way that's required. And I'm going to show you a bit about what I mean by rigorous. The other thing that's really good to do before you even get started and you're still considering doing a systematic review is to read one of the manuals that's available out there. There's a few different ones to turn to. One is the Cochrane Handbook of Systematic Reviews. So that's created by the research organization Cochrane, and they publish systematic reviews. They're considered a very high quality source of systematic reviews, and they've really set the standard in this area. So in their manual, they tell you exactly what they believe is the best process, the quality, what you should do, what kinds of people should be involved, how to document things. It's in the manual, and the manual is available freely online. But it's here, and it's got a lot of parts to it. So again, if you think it's quite straightforward, once you start exploding some of these things, you can see there's actually quite a few bits and pieces to it. But that's okay. It's good to know. It's good to know what you're getting into. There's also the Joanna Briggs manual as well. It's available freely online. They also have quite a few pretty detailed instructions. Theirs might differ a little bit in terms of what they require, but they still give you a good sense of what's needed. The other thing you can do is have a look at our library's guide to systematic reviews that we've put on our website. That just gives you a few things to start from. So again, what's a systematic review, some of the resources, what the overview of the process, just a little bit of a plain language overview. We're not quite as detailed as Cochrane, but it gives you a bit of a sense of things as well. And also it connects you to some of the library resources we have that can help you out. So, all right, so you've decided you want to do you still want to do a systematic review. Okay, all right, that's fine. The next thing to do is to look at your research questions. So, like you said, it's got to be clearly defined, and one of the ways you can do that is by using a question framework, and that's a way of just determining exactly what parts of your question, what things you're actually looking at, and determine the eligibility criteria, the types of studies and types of information you're looking at. So one of the most commonly used ones is the PICO format, PICO, and that's commonly used for clinical questions, but there are others depending on what type of question you have. So if it's a qualitative, it's evaluating a service, there's lots of different types of ways to structure your question, but I'll just use this as an example. PICO, it's looking at the different parts of your question, probably not news to most of you here, but population, intervention, comparison, which isn't always there, but it's an option, outcome, and then also types of studies as well. So it's important to identify the type of study you're looking at. An example of this, again, I was saying there's sort of a difference between being able to describe it to someone and being able to write it down and structure it in this format. And a couple of examples here are showing, maybe a question for a more qualitative study and one for a more clinical study. If I was to say I'm looking at the experience of endometriosis and how it impacts on women's lives, when I look at that with my librarian eyes, I think, oh, there's a couple of ambiguous things in there. Endometriosis, well, that's pretty straightforward, but I'm looking at the words experience and impact. They're really fuzzy. When we say impact, you and I, we might have an idea of what we mean, but actually we're not really defining that very well. So when you put it in the PICO form, you're saying, okay, we're going to talk about the population. That's obviously women. You might specify an age range, you might not. And when you're talking about the impact, the outcomes, you're saying, well, actually what I mean is pain and social relationships and self-image. Okay, That's very different from just saying impact. But sometimes you need to understand that you need to actually unpack that term, that broad term you've used. And then you might say, the studies I'm looking for are qualitative studies, so I might be looking at, narrative studies, so I might be looking at focus groups or interviews or things like that. And the more you're able to explain it, the easier it'll be. And the same for the clinical question down here. If we're looking at antimicrobial products and how they improve healing on patients with chronic wounds, we might be saying we're looking at various forms of chronic wounds. You might define what those are. You also might define what kind of antimicrobial preparations you're actually looking at. You might name them. And you're looking at randomized controlled trials, so it's important to say what kinds of studies you're looking at as well. So there's a lot of stuff that we have in our minds that we feel kind of goes without saying, but with a systematic review, nothing goes without saying. Everything has to be quite explicitly and pedantically well defined. Which leads me to the protocol. So that's the plan. What are you going to do? How are you going to do it? How do you ensure transparency? What a protocol does a few things. So it's your published plan. It not only keeps you honest, because it tells everyone in advance exactly what you're going to do and how you're going to do it, so they can see the difference between what you plan to do and what you actually did at the end. It also, can be peer reviewed, so it can help before you even start. It gives people a chance to actually look at your proposal and say, yes, this is feasible, this is good, or you might want to change it a bit. But what it does as well is it prevents duplication, because systematic reviews take such a long time to publish. Halfway through your endometriosis systematic review, someone in Japan might be thinking, oh, I think I want to look into this endometriosis and experiences. And it'd be terrible if you get to the end and they're in the middle and they see that you've published the thing that they're halfway through. It's terrible, right? So what you can do is you can publish your protocol in a journal. So you might do that, that's good. You get the peer review process and you published something, which is always great. But you can also just register your protocol in our database. There's one known as Prospero, which is the International Register of Systematic Review Protocols. If you publish that in there, all you're doing is they don't peer review it, but they just hold your place. So before you even start doing your systematic review, have a look in Prospero and see what's already being done, what's in the works. So this is an example of a protocol in Prospero, and this protocol has been created by a team at Monash, and it's to do with vitamin D supplementation on inflammation. So what they've done is they've put their questions out there, and they've sort of done it in a bit of a PICO form, sort of a very simple, concise question here. They've outlined where they're going to search, so what databases they're going to search in. Not only that, but all this other stuff that's a little bit more specialized, the types of studies they're going to include, and the types of studies they're going to exclude. They're going to go into a bit more detail about what they're looking at, the participants, so a bit more detail about them, about the intervention, the context, and what outcomes. They're going into quite a bit of detail here about how they're going to appraise the evidence, how they're going to select the studies, and then how they're going to bring it all together. And you can see that the team, again, it's a team, it's quite a few people. It's about 7 or 8 people there. What's interesting is they've got the start date of 30th of April, finish date of 31st of August. I don't know. Maybe they've got that many people they can crank it out, but they might have just said that. If you look down here at the bottom, it talks about the various stages of the systematic review and whether they've started it and whether they've completed it. And I don't know, maybe they just haven't updated this, but maybe they haven't started. I don't know. But it's good. It gives you a sense of what other people are doing. And it gives you an example to follow as well. So that's before you even start. That's the protocol. So once you've got that in place, let's look at the search process. Search process, and this is the same search process that I tell everyone to do. It's just a few different details. You've got your question. From that question, you develop keywords, alternatives to those keywords, subject headings. You brainstorm as many keywords and subject headings related to your question as you possibly can, as many as you can. Don't stick with the same ones. One of the things that I see that people really get stuck on is jargon in their field that they believe is applicable internationally, when it often isn't. You want to make sure that you're using terms that other people might use as well. I used to work in a TAFE, and they had the social work program, and it really was a social work program. When you graduated, you got basically a degree that qualified you to be a social worker, and they often went out and did social work. But for whatever reason, they like to call it social practice, because they're like, no, it's different. We also have this community development aspect. And I said, okay, that's fine, call it whatever you want. But when you're doing your research, don't type in the word social practice. It just doesn't mean anything to anyone but you guys, unfortunately. So you can make that distinction all you want, but you're only as good as the keywords that other people are using to put that research out there. So once you've got your keywords, develop a search strategy. So where are you going to search? How are you going to search? What's that search is actually going to look like? You're not just going to be putting in the word endometriosis and women and go and calling it good. I'll show you a bit more about what's involved with that. When you start searching, it's really important that you document your results along the way. Write down exactly what you've done, what you've searched, where you've searched it, what terms you used, any filters that were applied, the date, all of that stuff. And it's something we're not really used to doing. We just kind of probably just go at it when we have time, and then I don't know how I got here, but I got some great stuff. With systematic reviews, you've got to make sure that everything's really documented, because you will have to show and publish that documentation along with your review. Also, you've got to make sure to manage your results along the way. So this would mean, basically, I highly recommend that everyone uses a bibliographic management tool such as EndNote or RefWorks or something similar, because you have to be able to manage large amounts of data sets, and it helps you with the inclusion and exclusion process. And then there's the rest of it, which is the appraisal, which I'm not even going to go into. I'm going to let Ben do that. That's a whole other thing. One of the things that's quite interesting you can do, and again, this is primarily applies to health, but I think you can do it in other fields as well, is a thing called text mining, which is really cool. If your question is to do with omega-3 polyunsaturated fatty acids and whether or not they are good and safe and effective in treating dementia, what you can do before you even start doing your search in earnest is you can use one of these text mining tools to generate for you an overview of what kinds of keywords are similar to this in a database. Keywords, subject headings, types of journals that would publish things along this topic, academics who publish things along this topic as well. I'll show you. Easier for me to show you. So you take those main keywords, and I'll just show you what it looks like inside PubReminer. And this basically is pulling information out of PubMed. So if I put in these words, it'll tell me, okay, I've seen those words, but also here are some other words you might use that are similar. So this is helping you when you're building your keywords. So you can see here that it's found things like, polyunsaturated fats, but also omega, so probably omega-3. It's got things like that word, I think the DHA is also what it's called, which is one of the acids, I believe, that you'd be talking about. So good to not just group a whole lot of things together, but actually define them individually. You've got that and a few other things that you might not have thought about. Also, you've used the word dementia, and it's found a few words around that as well. So Alzheimer's, obviously, things like to do with cognition. So these are some keywords it's pulled out. So here on the right, you can see you've got the mesh terms. So there's the medical subject headings, and probably the most likely ones related to what you've put in. So omega-3 fatty acids, Alzheimer's disease, things like that. So whenever you do a search, it's important to combine the subject headings that are in a database and the natural language keywords that are also used by people who publish in the database as well. You can see that you've got authors there and a list of authors who've published in this area. So it's good for you to see, okay, these are some likely authors I might want to look at. Also, we've got a list of journals. So obviously, the Journal of Alzheimer's Disease and a few others. So if you're looking to really sort of intensively look into journals. It gives you a starting point. So it's not perfect, but it's a really good sort of place to start, and it gets you thinking. It gets you generating those keywords in your mind and start thinking about places to look. So that's one's called Pub Reminder. There are a few others, but I thought that was quite a fun thing to play with. So once you've got a few keywords down and you have a sense of what you might be searching, you'll start to document your search strategy. Now if you can see this, I know the font's kind of small, but this might not be a search strategy that any of you are used to doing. It's a bit different. Basically what you're doing with this search strategy, and this actually comes from the published omega-3 fatty acids in Alzheimer's study, so I didn't just make that up. Someone actually published that. What they've done is they've listed all of the keywords that they've searched, or the subject headings along to do with, say, dementia and Alzheimer's, first of all. So the number 1 through number 12, those are all things related to dementia or Alzheimer's. So you've got, obviously, dementia, Alzheimer's, then you've got things like cognitive or impairment, and a whole lot of codes which are sort of very specific to that database. So you're searching, using truncation, which is that little asterisk. There are lots of tools you can use, but basically what they've done is they're using variations of words: functional impairment, cognitive decline, vascular dementia, Lewy bodies, I don't know what that is, I'm sure one of you does, and a few other things. So they're not just using those words, Alzheimer's and dementia, they're actually exploring ideas around that. And then what they've done is that you can see on number 13, they've actually combined all of those things together. So 1 or 2 or 3 or 4 or 5 or 6 or whatever. And what you've done then is you've created a group, and that group is all of the words that could possibly be connected or related to that concept of dementia. So when you're doing that one search, all you would have to do is use number 13 on your list. And that's something that brings all of those words together. Then they've done the same thing with omega-3 fatty acids. So they've put in the words fatty acids, omega-3. They've also put in that acid and the other acids, and they've listed those, and they've grouped those together as well. And they've done the same thing. It keeps going, trust me. It goes way down. But when you're searching, wanting to find everything, this is what you need to do. So they're using terms beyond what they originally thought they'd need to do. And then once they've got those sets, they can just apply them to the searches, and they know that they've captured as much as they possibly can. Now this isn't something they sat down and did on day one. Okay, this would have taken a long time to get to this point, to test these keywords, to see if they're relevant at all, and this is the finished product. So don't expect that you just sit down and just make one of these lists. This is the best case scenario. This is the list you use if you want to replicate what they've done, and it's the easiest way to replicate it. It takes a bit of practice, and thinking about things in this way, everything is a set and then combining, it's a little bit different, but you can see exactly what they've done, and that's the transparency there. So this is the kind of stuff that we in the library advise you on, is this kind of stuff. We don't do it, but we advise you on it. So as you go, really important to document your search. You can do this in a few different ways. One thing you can do is, there are a lot of databases that will actually track what you're doing and save your searches. So for example, in PubMed, you can create an account, and it'll actually track everything that you've done in PubMed, and it keeps track of your searches. You can save searches in other databases as well. So if you're not wanting to write everything down, it'll actually record what's happened in that search session that you've done. You can also just write it down, document it as you go. There's a form that I made. It's not very fancy, but it's just on this part of the Systematic Review's website. There's a little documentation sheet, and all it is just a way of saying where you searched, what you searched, and what keywords you used. It helps you to sort of keep track of these things, and then comments. So you might say, this keyword's good, this one didn't work so well, might not include that, this was a dead end. but it helps you because towards the end of this, I mean, again, if you're looking at a year-long process, by the end of it, you're like, how did I get all this stuff? So this will help you with that. The other thing you can use is to guide your process as well is the Prisma diagram. So this is basically a standard for how you work through the process, and this is more sort of along with this, basically what Ben will be talking about. But basically, when you're downloading when you're looking at searching in the database, you'd be looking at X number of records, and then you could probably download them into something like EndNote, and then remove the duplication. Then you've got another number after the duplicates have been removed, and then you screen them for whatever your criteria are. You remove those, and putting them into EndNote helps keep track of that because you can put them into groups and separate them out. But you can still have sort of the original list should you need to do that. But this Prisma statement is just basically a guideline to assure sort of consistency and quality in this process, and that's what the Cochrane Group and others recommend that you use for the Prisma statement, it's called. So as I said, you just make sure that you are reporting your search according to wherever you're publishing. Some places might have slightly different criteria. They might ask you to document it in a particular way. So it's always good to check with wherever you're intending to publish this review and what they're asking you to do. But when in doubt, you can always just go with the standards of the Cochrane Group. In terms of where to search, it depends on your discipline, but it's always good to start broad and then go narrow. So start with the general databases. So in your field, you might have some pretty broad ones. In education, you might have ERIC. In medicine, health sciences, you might have PubMed. You'd obviously use Google Scholar as well, and do those big broad searches there in those. But then you also want to look in the specialized subject databases, so ones that might be more to do with allied health, more to do with physiotherapy. And look in those, use the controlled vocabularies they have in there, the subject headings that they have in those particular databases. That's one of the frustrating things about this process is, unfortunately, with every source that you search, you'll have to actually adjust your strategy because not all of them are going to have the same subject headings in every database. You might search in Ovid and then in PubMed, and they'll have completely different methods for adding subject headings to things. So you do have to check with those and change things. And also there are different rules of different databases in terms of truncation and how and those little nitty-gritty things as well. So I recommend that you read the manual for those databases before you use them to get those little tips and tricks down. You also want to look at the grey literature. So grey literature is things that aren't your typical mainstream sources. So conference proceedings, theses, government reports, presentation. There are a few sources that are good for finding grey literature. Google Scholar can be quite good for it, but there are some databases that are quite specifically about grey literature, and those are on the Systematic Review's webpage as well. And then you might want to look at things like registers of controlled trials and other things that are, even more specific. Reference lists, going through those. You can use the cited by function. So Google Scholar, for example, if you find a really great article, you can use the cited by feature underneath it. It'll tell you who's cited that article since. So you can sort of look back in the reference list and look forward using that cited by. Help resources along the way. Yep, you can definitely ask liaison librarians in your field to guide and advise you. Some people feel pretty good, they just want to check in. Other people are actually like, look, I don't actually know how to search. I really just get started from the basics. Completely fine. Whatever level you are, we are happy to help you with that. Also, have a look at the manuals. Like I said, good and important source. But also, there's a few great books in the library, and I've used a few of them myself. We've got a list of them here, but these are really good because they're better than a manual. They give you a bit more detailed information. They give you case studies. They're really helpful. There's some great books out there on systematic reviews. So I really suggest you have a look at some of those. And that's part one. So I'd like to introduce Ben Wan from the School of Physiotherapy, and he's going to talk to you about the second part of the process, which is actually appraising the data that you do find.